In the end of the case, you'll see the problem with don't have any relations with the lower teeth. It's something that's hard to do in traditional ways. The first result that you have, it's probably very close to the end result you'll want.
Welcome back to Unique Dental Show, where we discuss interesting cases and new procedures. Hi Aniv, welcome again.
Hello.
Wow, I see you more than my wife.
Yeah.
So what
Today only.
Today only. What case did you bring for us?
Well, today we brought a case when the patient had all denture, upper denture based on implants, and we've added some implants, took impressions, and made a bridge. In here you can see the upper denture. Mostly the complaint was aesthetics, because you can see it's chipped somewhere, the aesthetics are not great, you don't see between the teeth any separation. It's very old denture, she wanted to change that. In here you can see, after adding some implants, how it looks. You have about 6 implants. 2 implants are angulated ones, 3 implants are angulated ones. You can see those 3 are angulated, and those 3 are healing caps on straight multi-units. This is what we used in here. So all in all 6 implants, 3 angulated, 3 parallel on straight multi-units. Those 2 were added, those implants are the old ones. So we've added 2 implants straight, and they were added quite good with the proper angulation. The old ones we need because there was a denture and we wanted to use those implants. We needed to use angulated multi-units. In the end of the case, you'll see the problem with angulated multi-units when you have some buccal bulge and you see the multi-unit, but in this case you don't have any other option, because it's either the bulge or you have a screw channel going from your frontal tooth.
So you're screwed either way.
Yeah, it's screwed no matter what to use. When you're taking impressions on a whole complete edentulous jaw, you have a problem because you don't know the relations between the impressions. You know, you can take impressions very good on the upper jaw with different types of scan abutments, everything you want. But then you don't have any relations with the lower teeth. So how do you make a bridge with proper relations? And in here the CAD-CAM has great benefits, because with CAD-CAM you can have different impressions. Because it's the upper jaw, you have all the palatal surface. So you can correlate different impressions using the palate. What would be quite difficult if you take traditional impressions. So in here you can see different parts that were used. First ones, you can see scan abutments, the white ones. You can see a composite material that was used to take the relations between the jaws. Central line, you have all the information here. You can see what we got in the end, because at first we took impressions just with scan abutments on multi-unit level. You have all the information, but you don't know what teeth you need to do. You don't know anything because you don't have the relations between the upper and the lower jaw. So in here, some of the scan abutments we covered with composite material. The greatest advantage of the composite material is it's very hard, so the patient closes his mouth each time the same, exactly the same. When you use wax, you have this problem, because it deforms. Each time he closes his mouth, it closes a little bit different. So in here, when we use the composite material, we just cover the lower teeth. We know the height that we want. We can see how the patient closes his mouth, his lips, all the soft tissues. And this is how we know what to do. When you use wax, in most cases you use very thick plate of wax, and you don't have any soft tissues management. You don't know how the lips would be, you don't know the height. No, the height you know, but you don't know how the soft tissues in relation to the wax. In here, the composite very thin. You just close this mouth on the composite, and that's all. You don't need to cover all of these kind of abutments. You just need to have the relations, and using the kind of abutments and the palatal areas, you can this impression relate to that one. You can have all these kind of abutments clean without any composite material, and you'll have the clean impression in the relations of the impression with the composite material. You'll have a great impression.
With all the indicators that you need.
Yeah, with this kind of abutments, with the gingiva, with everything, without the composite material. It's something that's hard to do in traditional ways because you can, but it's not that accurate. In here, you have great accuracy.
This composite, it's widely used?
I personally believe that in many cases, it's much better than wax. You can have much better results. You have the consistency of the closure of the teeth. You have each time the same result.
What other information can you extract from this type of scanning?
From this type of scanning, you can extract any type of information you want. Because if you want the midline, you can just mark it and then scan it. You'll have the midline, like you see here. If you want to know where the canine is supposed to be, you can add a little bit of composite and mark. You know the height because the upper and lower jaw are in occlusion. You can have any information you want. You even can mark the upper teeth, how you think they need to be marked, separated in the end. You scan it. If you use intraoral scanner with colors, you can just mark it with a pen. You don't need to mark it like making lines. It will scan the color and you'll know all the information you need. Later on, you just make a bridge on those kind of abutments. You can see we have here 3 angulated ones, like we said before, that we used to correct the angles. We have 3 implants that that used on a straight multi-unit. Both were used with a standard sleeve of 4 millimeters. You see all the screw channels except this one are perfect. This one, we already use an angulated multi-unit. You can have a much better result, but because it's distal to the canine, you don't see the screw channel. It's still not like the screw channel goes from the buccal of the frontal teeth. You can see that you have, from the start, quite good occlusion. This is without touching anything. You see the teeth are exactly as we placed them. You can see the angulated multi-unit, like we said. We used an angulated multi-unit, but you still see a little bit of the metal. You have some compromise when you use angulated multi-units. On the one hand, you don't want to have screw channel going out of your frontal teeth, and on the second hand, you don't want to have this. But in this case, she have enough gingiva, and it's much better not to have a screw channel goes from right here. So we used an angulated multi-unit. We saw in her smile that you don't see this metal, and from aesthetic point of view, it's a good result because you don't see anything.
She liked it.
Yeah, she liked it.
Amazing.
Probably, yeah. All in all, the bridge in the occlusion, you need to a little bit correct and everything, but you have great occlusion from the start. This is the temporary bridge. After that, you'll have a little bit, you need to wait for adaptation, you need to have some corrections. You have what to do, but the first result that you have, it's probably very close to the end result you'll want. This is why taking impressions with intraoral scanner, making 2 impressions, one impression clean, the other one that with composite material, and relate one to another, gives you good results. You'll have all the information you need. If you look on the midline, it's like what you have on the impression. The same, you have a little bit shift to the right side of the patient. But I don't remember here, but probably it goes like with the face. there is a slight shift in the lower teeth. So in this case, I think it's a great result.
Thank you, and for the case.
You're
See you
welcome.
next time.
See you next time.
Thank you for being with us today. See you next time. Don't forget to like, subscribe, and follow us. And like our technician also.